Hi, I'm Paul Gabriel Scullion, Director of Biomechanics Foot Laboratory. I'm a podiatrist and also a podiatric surgeon in practice here in Dublin. Welcome to this short video entitled Good Cast, Bad Cast. It's part of the educational series we have on our webpage. Mastering the casting technique is essential. The better the cast, the better the results are for your patient. I have 10 points to guide you to evaluate your cast. These points are written out for you on our webpage as well. Point 1. Clearly mark your patient's name on the bottom of the cast. Point 2. Create an even, deep cast along the full length of your cast. We want you to capture the lateral malleolus and do not crush the front part into the toes. Here's an example of one that is too shallow. The lateral malleolus has not been captured and the plaster has been crushed down into the toes. Point 3. No air bubbles inside the cast. What we prefer you to do is have total contact of the plaster on the skin. Here is an example of an air bubble in a cast. I've marked it out with a pen to emphasize it to you. When we fill that cast up and break it out, this is what we are left with. We've also coloured the plaster here so that you can appreciate what an air bubble does to a cast. Point 4 is the double overlap. This is a small fold of plaster that you create at the start of your casting of your patient. It's here because it adds a rim of strength around the top of the cast, and it also makes it stronger for removing from the patient's foot, and also provides additional strength for when you send it by mail to the laboratory. Point 5. Bandage overlap. This is where the two bandages overlap each other and provide good strength in the cast. This is what it looks like when it's done right, and this is what it looks like when it's done wrong. Point 6. Applying your plasters in quick succession. This is what happens if you allow one bandage to dry out quickly compared to the second bandage. It creates a line right across the width of the cast. Point 7. Correct dorsiflexion of the foot. In the vast majority of cases, the back of the heel compared to the plantar aspect of the heel should be 90 degrees, not unless there was an equinus condition present. In this cast you can see that the angle is not 90 degrees. This is either an equinus condition or it is the practitioner incorrectly dorsiflecting the foot. In some cases you can over dorsiflex the foot and this creates less than a 90 degree angle. But again, the thing to keep in mind is that's an incorrect cast. Point 8. No tension on the toes from the bandage. We prefer that you take a cast the toes are relaxed, like this. Here's an example of a cast where the bandage has been put on too tight. You can see the tops of the toes. This in turn will cause a pressure on the toes, which will cause the metatarsals to plantarflex, thus losing the neutral position of the foot. Point 9. Allow the cast to fully set before you remove it from your patient's foot. In this case, you can see that the cast has been crushed because it has not been fully set. Best way of checking it is to tap the cast. A nice hollow sound like that indicates that it's time for the cast to come off the patient's foot. Point 10 is thumbprint placement. In this technique, the thumb should be placed directly on the 4th and 5th metatarsal head. I've drawn an outline of my thumb to show you how to do it properly. When it's done incorrectly and you miss the metatarsal heads, then you're going to create an abnormal bulge on the sole of the foot. This will compromise the orthotic that's going to be made for your patient. I hope you found this helpful. Next time you take a set of casts, I hope you will evaluate them using these 10 points. Remember, you can fine-tune your techniques. Better casts make better results for your patients. For more videos, visit our website www.biomechanicsfootlab.com.